You are listening to A Path to a New You, a podcast about mental health and veterans issues. Did you know June is PTSD Awareness Month? I know a lot of you may know that June is also Pride Month, but it is also PTSD Awareness Month. PTSD meaning Post Traumatic Stress Disorder Awareness Month. In today's episode, I want to talk about PTSD. I want to talk about the symptoms. I want to talk about the symptoms and what to do if you have it. And I hope you learned something today. So, what exactly is PTSD? Post traumatic stress disorder is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. Most people who go through traumatic events may have temporary difficulty adjusting and coping, but with time and good self care, they usually get better. If the symptoms get worse, last for months or even years, and interfere with your day to day functioning, you may have PTSD. Getting effective treatment after knowing your symptoms of PTSD can be critical to reduce symptoms and improve your function. So the sooner you go get treatment or talk to someone, the better off you are. So what exactly are the symptoms? Post-traumatic stress disorder symptoms may start within 1 month of a traumatic event, but sometimes symptoms may not appear until years after the event. These symptoms cause significant problems in social, social work situations, and in relationships. They can interfere with your ability to go about your normal daily tasks. PTSD symptoms are generally grouped into four types, which include intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Symptoms also can vary depending on the person. So, from person to person, the symptoms can vary. So, what are these intrusive thoughts? These intrusive thoughts are symptoms such as recurrent, unwanting, distressing memories of the traumatic event, reliving of the traumatic event as if it were happening again, such as flashbacks, upsetting dreams or nightmares about the traumatic event, severe emotional distress, or physical reactions to something that reminds you of the event. Avoidance, which means trying to avoid thinking or talking about the traumatic event. Avoiding places, activities, or people that remind you of the event. Negative changes in thinking and mood. Symptoms of negative changes in thinking and mood could include negative thoughts about yourself or other people, hopelessness about the future, memory problems, including not remembering important aspects of the traumatic event, difficulty maintaining close relationships, feeling detached from family and friends, lack of interest in activities you once enjoyed, difficulty experiencing positive emotions, and also feeling emotionally numb. Some of the changes in physical and emotional reactions. These could include being easily startled or frightened, always being on guard for danger, you're always on guard, trouble sleeping, trouble concentrating, irritability, anger outbursts, or aggressive behavior, and also overwhelming guilt or shame. So those are just some of the symptoms, the memories, intrusive memories, the avoidance, avoiding the area where it took place, avoiding the people, trying to avoid thinking or talking about it. Um, yeah, those are just some. And then also you got the negative thoughts about yourself, hopelessness, memory problems, difficulty maintaining close relationships, lack of interest in activities you once enjoyed. So these are some of the symptoms that could come overall if you do not get treatment right away. Because the sooner you get treatment, the better you are, the better off you are. If you keep getting, if if you don't get treatment, I guess I'm trying to say, is if you don't get treatment right away, the symptoms will increase and will get more difficult. I guess that's what I'm trying to say. So again, the intensity of the symptoms, I just talked about this. The PTSD symptoms can vary in intensity over time. You may have more PTSD symptoms when you're stressed in general and when you come across reminders of what you went through. So, exactly, what are some of the causes of PTSD? You know, I'm sure a lot of you out there are saying, you know what, military, if you're in the military, that's the only way you can get PTSD is through the military. That is not 100% true. I'm going to talk about that here in a minute. Actually, right now. So, what are some of the causes? PTSD is probably caused by a complex, a mix of stressful experiences, including the amount and severity of trauma you've gone through in your life, inherited mental health risks, such as family history of anxiety and depression, inherited future features of your personality, often called your temperament, and then the way your brain regulates the chemicals and hormones your body releases in response to stress. So, some of the risk factors are experiencing intense or long lasting trauma. So, if you experience this trauma over and over and over and over again, like constantly, that could definitely cause you to have PTSD. Having experienced other trauma earlier in life, such as childhood abuse, that's what I just mentioned. It's not just anyone in the military, can have PTSD. If you have childhood trauma, childhood abuse, anything like that growing up, that would definitely cause PTSD. I do have PTSD, and it's through the childhood stuff that I went through. As some of you may know, I was adopted when I was 9, and before I was adopted, I was in foster care for 4 years. And before I was in foster care, I was living with my birth parents, of course, and there was a lot of stuff going on with my birth parents, fights, you name it, it happens. Cops were called all the time. Yeah, so that's how I got PTSD. I was in the military, but that's not how I got PTSD. Also, some risk factors could include having a job that increases your risk of being exposed to traumatic events, again, such as the military, first responders as well, like police, firefighters, and first responders. Any first responders, you can just having that kind of line of work can definitely increase your chance of being exposed to traumatic events. Having other mental health problems such as anxiety or depression, the more you don't get treatment, the longer you stay away from treatment, the harder it gets. Lacking a good support system, family and friends. What are some of the traumatic events? I just talked about the military. You got combat exposure with the military. Also exposure being as a police officer. You got, depending where you live, Chicago, LA, Houston, pretty much anywhere you might have those high speed chases or these shootouts or anything like that. That's also can be considered combat exposure. Childhood physical abuse, sexual violence, being threatened with a weapon, like a bank robbery or something. You work at a bank or someplace and you're getting robbed, that could cause it. An accident, like a severe accident where there's someone killed, a really bad accident, that's another traumatic event that maybe over time you might get PTSD from. There's other um, situations too which you could get PTSD from. Those some of those are just the common ones. So, with PTSD, post traumatic stress disorder, there are also mental health problems that come with PTSD. Depression and anxiety, eating disorders, and suicidal thoughts and actions. So with PTSD, there are symptoms. You're depressed, severely depressed, the anger issues, anxiety. That's all PTSD. You could have PTSD and also with PTSD, you could have depression, anxiety, anger issues. And over time, if you don't get help right away, you'll have issues with drugs and alcohol use. So if that happens, that's another situation where you have, instead of one thing you got to work on, you have two things, with your alcohol or drug use and also your mental health use. So those are two things that need to be worked on, that you need help with, instead of one. Eating disorders, over time, if you don't get treatment, you could have an eating disorder, and that's another thing that you would have to work on if that came about. Suicidal thoughts and actions, those are another thing. You might have suicidal thoughts, and you actually might try to do something to resort to suicide. But there's ways to prevent this. Again, getting timely help and support may help prevent these normal stress reactions from getting worse and developing into PTSD. Like I said, the sooner you get treatment, the better you are, the better off you are. This could mean turning your family and friends support system. Also, it could mean seeking out a mental health professional, like a therapist, psychologist, psychiatrist, anyone like that. Psychiatrists, they're the ones who psychiatrists are the ones who can administer medications, who can prescribe medications, as well as your primary care doctor, therapist, or psychologist you'd see once a week. You talk about your issues. Some people get psychologist and psychiatrist mixed up. Psychologist, they went to get their doctorate degree. Psychiatrist went to med school. That's a part of med school that you got to go through to become a psychiatrist. Psychologists, they cannot prescribe medications. It's the psychiatrist and your primary care doctors who can prescribe medications. I know some people get that confused. When I was getting my doctorate degree, become a psychologist, like, oh, you can prescribe medications. Or I tell them I'm a therapist. Oh, you can prescribe medications. I'm like, I cannot. I went for my master's. Someone who went through med school, like a psychiatrist or your primary care doctor, can prescribe medications. I tell them, I could actually refer you to a psychiatrist if you need one, but I cannot prescribe medications. Also, getting support from others may also help prevent you from turning to unhealthy coping methods. Like I said, misuse of alcohol and or drugs. So when exactly Would you need to go see a doctor or therapist? If you having thoughts and feelings about a traumatic event for more than a month, if they're severe, or if you feel like you're having trouble getting your life back under control, talk to your primary care doctor or mental health professional. Reach out. There's, there's therapists online now. There's online therapy where you can go talk to somebody. Just reach out. Getting treatment as soon as possible can help prevent PTSD and symptoms from getting worse. Like I keep mentioning that overall today in today's episode. Getting treatment as soon as possible can help prevent PTSD symptoms from getting worse. The quicker you are to get your treatment, the better off you are. If you keep delaying it over and over and over time, it's gonna get worse. And then eventually, I can take care of myself. I can, I'm tough. Because if you lately, this whole stigma of getting treatment, mental health treatment, the stigma hasn't been as bad, but before COVID, there was if you went to go treatment, you're considered weak. Now, considered treatment, it's everyone's going to therapy now. Almost, I don't say everyone, but almost everyone. So it's okay to reach out, get support, talk to a therapist, talk to a psychiatrist, psychologist as well. Talk to a mental health professional. It's okay to do that. You're helping yourself by doing that. Even I see a therapist. The sooner you get treatment, the better off you are. The getting treatment as soon as possible can help prevent PTSD symptoms from getting worse. Again, if you delay it over time, you may take on to drinking alcohol, using drugs, and over time you'll be it's called self-medicating. And if you do that over time, that's another thing you need to worry about, another thing you need to get worked on, or another thing you have an issue with, which means instead of just the mental health of PTSD, you also have the substance use, alcohol and substance use to work on as well. So that's two different things. So might as well get your treatment, go to treatment as soon as possible. If you're having suicidal thoughts, I always tell my clients this, if you're having thoughts any time of day, 24/7, you can either reach out to a close friend or loved one, contact if you go to church, contact your priest, a spiritual leader, or anyone like that. Also, the suicide hotline, which now in the last couple years has a text. You can text the crisis line too at 988. Text 988, and you can reach out through text, or you can call that number too. And also, there's chats online too. You go to your computer, you can chat. If you there's always there's someone you can reach out to. You can call 988 or text 988 to talk to a professional on the other line who's trained on how to talk to you. Everyone you talk to, those you talk to at the 988 number are professionally trained. A lot of them are therapists actually themselves. And also make an appointment with your doctor or mental health professional. If you don't have a mental health a therapist, you can always go search online. A good site to go to is psychologytoday.com, and there you can find a therapist close to you by looking up area code. If you're struggling with PTSD, you can um, find therapists who are specializing in PTSD. And yeah, if you're part of the VA, go to the VA because they have therapists there too. It would definitely help. If you actually think you're going to hurt yourself or hurt somebody else, please call 911. Call that right away. That way you can get help right away through that. Anyway, I hope you learned a little something today. about PTSD, the symptoms, um, and the treatments. Not necessarily the treatment part, but hope you learned something today. You can find my podcast on pretty much any major streaming service: Spotify, Apple Podcasts, Google Podcasts, YouTube, any major streaming service. Just look it up. It's free to listen to. Please like and follow. I also have a Facebook page, A Path to New You. Facebook, I will post that in the comment area when you search, when you go through my episodes. There'll be a link there. You can click on there, and then I do post my episodes on there. I do post mental health, self care ideas and stuff on there as well sometimes. If you would like to be a guest on my show, please reach out. You can reach out through my Facebook page, A Path to New You. If you know someone who specializes in a certain topic, m- whether it's mental health or you're a veteran or any military or anything like that, and would you like to be a guest on my show, please reach out. I'd like to have more guests on this show. I haven't had one in a few months. I know some of you are tired of just me talking. So the more guests I have, the better off, the better this podcast is. Again, you're listening to A Path to New You. Please rate and yeah, please rate when you're done listening to this episode. Please rate it. I'd really appreciate it, and review as well. Again, you're listening to A Path to New You. Have a good rest of the day. Be well.